the last video we ended up with Louis Pasteur, but let's delve into some of the other New Age scientists at this time. And it saved a lot of lives also. Joseph Lister. Okay? Joseph Lister. What does his name sound like?
Listerine?
Exactly. Exactly.
I was going to say something.
What's Listerine?
Mouthwash.
An antiseptic mouthwash. Okay? Anti meaning without, sepsis mean rot or decay. He discovered that you could clean surfaces and even body parts before doing a procedure or cleaning other surfaces. Mainly it was in body parts. You know, just by cleaning the person's abdomen before you do the appendectomy or whatever. Wrong side. But doing all that kind of stuff would cut down on a lot of problems. And he invented a lot of these antiseptic chemicals that were safe for use on the human body. So when you think of Joseph Lister, think of Listerine. Pasteurization of milk. Pasteurization of milk. Killing the bacteria that's in milk. Okay? Ernst Von Bergman. He did more for the cleanliness of the technique and the instruments. So you got Lister cleaning the person, getting rid of infection. Even y'all, it's not a bad idea when you get a strep throat or something like that that's orally in nature to use a mouthwash to clean the area constantly, and it will keep the illness from being so prolonged. It'll cut it down. Okay. It also prevents you from getting them if you use it on a regular basis, especially right after you had dental work done or been flossing a whole lot, and you've got open or bleeding gums. Use it, and it will take care of the situation. But Ernst von Bergman said, hey, let's take this a step further, and when we do surgery, let's clean the table, let's clean the instruments, let's sterilize them, or at least disinfect them before we use them on the patient. We'll talk about sterilization and disinfection later in key terms. Basically, and you'll hear this again, sterilization is the killing of all microorganisms on a substance, where disinfection is killing most, but not all. Okay? Let's see if I can finish a few more of these. This one won me the $1 million on Who Wants to Be a Millionaire. No, not literally. My family, when that show first came out, they loved watching it. And I remember it was one Christmas or something, and they were all in the living room watching it. And I was too busy. I wanted to be playing football outside. I had to clean my mom and dad's house, you know, because when you get older, Austin, go ahead and prepare you for this. When you get married and you're older, every time you go to your in-laws' house, they've got a list of things that you've got to do. You know, clean the gutters, fix the roof, fix the light, fix this. So you spend the whole time. Anyways, the whole family's in there watching this. I'm not big on game shows, but Camp Fender is. Boy, we used to take Camp Fender to the mountains in Gatlinburg, and we had all this fancy TV channels, and, you know, one of them's nothing but the game show channel, and he would sit there the entire time and watch the game show channel when he was little. He loved game shows. $1 million question, who's the father of modern bacteriology? And I'm walking by, and I hear it, and I go, Robert Koch. And I walk on to do something else. And the whole family's like, oh, no, he don't know what he's talking about. And lo and behold, they announce it, father of modern bacteriology, Robert Koch. And the whole living room erupts. You would have won $1 million. You know, but I ain't seen none of that $1 million. It was some other guy that was on TV, you know, or Slumdog Millionaire, whatever, who won it. But in most circles, his name is pronounced Coke, like Coca-Cola. Realizing what was going on with bacterial infection. Okay? You got Leeuwenhoek realizing that there are small organisms that can be seen with a microscope that are causing illness and things. But now we take it to the next level of something even smaller that's identified as an animal, bacteria, that can cause illness. Wilhelm Roentgen, what did he discover? X-rays. He also worked on the research of somebody they mentioned in the Big Bang Theory a whole lot, Madame Curie. Madame Marie Curie, the French female scientist who, working with her husband and looking at the research of Roentgen also, worked with a lot of radioactive materials. Okay, they would create that CRT that we talked about a long time ago. Remember we talked about the cathode ray tube, and I told you there would be a relation to it. Oh, that is an ugly looking light bulb. Okay. That basically a light bulb is two rods with a different type of element inside of it. Okay. And by changing that element inside of there, you get different responses. Well, they were putting radioactive material in there. And Roentgen had a whole bunch of photosensitives, was it silver nitrate, I think, I'm not sure, plates all around his lab. And when he activated one of the tubes with radium in it, he noticed that his photosensitive plates were exposed. When he developed them, he saw the inside of his arm, which led to the invention of X-rays that we use so much. Still, even today, we use radiation-based X-rays to find out what's going on inside of you. Because what happens is when the X-rays, the gamma radiation that is released goes through your body, it stops at the bone but passes through soft tissue. And therefore you get that image. Okay? Paul Ehrlich. He started using other types of chemicals to work with illness that you would give the patient. And the one that he worked with was the major cure for, or a way to treat, what did we say was one of the major causes of illness in the early times? Syphilis. Okay? So he worked in curing syphilis with other chemicals to give the patient. And we're going to stop there for today.